1. And we're live. TikTok live number 53. Top 5 listeners tonight, guys. I'm going to give you guys a shout out in the caption on YouTube podcast, the recorded version on it. Guys, I think this is going to be a big week coming up, by the way. I'm pretty sure we're going to have, I don't know, the market's looking like a crash. Has anyone been looking at that? It looks kind of scary. Colin Mayer 33 says sitting on nights waiting for admits. Yeah. We had 2 admits overnight on Friday, discharged 2 on Sunday, readmitted another one Saturday night, last night. Took someone to the OR this morning during the day. And then, that's where we're at right now. I'm on second call this weekend. So user 1171 said, you reading out my user, LOL. Yeah, I don't know. It's funny, right? What's up? How's the weekend? Yeah, so that's how the weekend's going. A lot more busy than I would like, On second call, I kind of just want a out weekend. This was not a chill weekend. We went to the OR. I've had to go in a bunch of times, like 5 times between Friday night, Saturday again, today twice. Chase Gundersen said, how does it feel to be close to the end of residency? So I got 3 months left. Tonight is exactly 3 months left, actually. Now that you mentioned it, that's 12 weeks. Yeah, it's coming to an end. How does it feel? I don't know. I'm not really nervous for the next step. I'm just trying to get to it, and I'm ready to go. I don't know. It's funny. One of the chiefs last year about this time that was graduating was like, yeah, it's kind of anticlimactic. And yeah, it's kind of weird how that feels. I would say, Chase, that's how it is. Unfortunately. Yeah. I don't know. It's exciting to finish, but it's exciting for different reasons than what I would expect. Yeah. User 26634. Hey man, how did you study for pathology in dental school? I love your content, by the way. Actually, oral pathology was strictly Quizlet. Quizlet cards, every Quizlet card needs to have a figure on it. We're visual learners. The majority of people are visual learners. You'd have to have either an x-ray on there or a clinical photo or the histology. You have to have those on there. That's how you're going to remember and retain the information of oral pathology and get those repetitions in. Get the decks, go through them. That's how I did very well in oral pathology, actually. Shannon said, I'm on day 7. My back gums are inflamed and I'm paranoid I have an infection. Have you gone to a dentist yet? Probably a good idea, right? If you're going to, if you're inflamed, you got swelling back there and you're in pain, if it involves your teeth, you should probably visit a dentist. Go to dentist. Ashi said, any advice for extraction endo-treated molars? I was left chasing root tips recently and it was miserable. Oh, yeah. After endo-treated molars, could be a little bit of ankylosis. You could sometimes see it, loss of lamina dura on the x-rays on a PA, especially that's always, it's hard to predict those, but yeah, sometimes those endo-treated molars, especially those first and second molars after endo on the mandible. Yeah, those are brutal. Those are some of the worst teeth to take out, I would say. Avi Saxena 592. Hi, I think I need to have jaw surgery. Do you work with any orthodontists? Right now, we work with the orthodontic department right across the street over there, actually. Associated with our oral surgery program. So, do I work with any dentists? Not me specifically necessarily, but the programs work together. Hunt 420. Quizlet is low-key cheating? No, I don't think so. If you study at home, I think it's studying, right? Avi Sexena 592. Hi, I think I have to have jaw surgery to work with orthodontist again. Here we go. Shannon said it's post-wisdom teeth. What's post-wisdom teeth? Oh, after your extraction? What do you mean post-wisdom teeth? Like you had your wisdom teeth removed and now that's how you're feeling? Go for the follow-up after that dentist that took out those wisdom teeth. They'll give you an idea. If it's day 3 to 5, and you're having the worst pain in the world, you might have a dry socket. And they should have some medicament that they can put in the extraction site to help with that. So, yeah, let me know what you think about that. User 4457, how did you study for the CBSE plan overall? Actually, I mentioned all that on the CBSE dissection. You could type that in, CBSE dissection. I did a podcast with Axe. We went through the things that I had recommended to study for the CBSE and then his modified version, because we have new materials now, new resources. I would recommend that. I've got a lot of feedback that people follow that to the T and have gotten very high, much higher scores than their first time they took it. So I would follow that podcast. There's a lot in there to check out, okay? Kayer Vanam said, junior and undergrad, just took my DAT and applying in May. Any advice for applications? Yeah, get as high of a score on your DAT as possible. Get that application earlier rather than later, and work on good letters. Get some good letters of recommendation to mentors that you had throughout college, okay? I would stick with those right now. cbenjiiiii said, what's going on, man? What's up, cbenjiiiii? How are we doing? How was your weekend? You do anything fun? User 3414 said, small skin tag on my lip, not painful or white, is blanchable. Every time I bite it, off, it comes back. I would see an oral pathologist or an oral surgeon about that. You gotta get like the stalk. You gotta get underneath the stalk. And when you bite it, you're probably not getting underneath like that foundation area. So you could just, we could get that out with a scalpel, just really quickly, suture it up, you'd be fine. Brenny Manier said, would you let a general dentist do a root canal or an endodontist? Or there's some teeth that endo should do? I guess that's what you're asking. Yeah, I mean, I would probably go to an endodontist if I want to get a root canal. They're the specialists in root canals, so I'd probably go to them for that, just me personally. I'm sure they're very capable and general dentists that have great success rates and stuff. It's just we have a specialty designated for root canals. I would probably go to them, just like I would go to an orthodontist to get my teeth straightened, just like I would go to an oral surgeon for wisdom teeth or dental implants, just me personally. Maybe I'm biased. Brené Manier said, would you just said that Jim89970, how do you think AI will change the dental industry? That's a great question. I think it's going to be a very adjunctive tool. It's not going to take jobs necessarily, especially in dentistry, but I think it's going to be a great adjunct for like reading x-rays, for diagnosing pathology. I think there's a lot of potential there. I really do. Yeah. Next one, we got, free TikTok coins said max out with, oh wow, we got spam in TikTok lives now? That's too bad. That's too bad, TikTok. You should figure that out. Lee said, just got TMJ. What should be the first step to clear it up? Well, you don't just kind of get it. Most of the time it develops over time. How should you clear it up? You could try a night guard. Sometimes night guards make it worse. I mean, you should go to someone who really focuses on the TMJ and get a consultation with them. Get x-rays, take a clinical exam. That could be helpful. Shannon said yes. On Blank said, thoughts on the marginal mandibular branch? Yeah, you don't want to hit that when you're going in through the neck, maybe doing a mandible fracture repair, a bunch of things. Casey1942 said, you the man. Carter said, how does a dry socket occur after the extraction? Generally, a dry socket, now a bunch of things could cause this, right? But generally, what a dry socket is the pain is coming from exposed bone. You have exposed bone that happens when the blood clot gets dislodged from the extraction site, right? And then the body thinks it's still there for the initial phases of healing, but it's actually gone. It was dislodged, right? So the body doesn't start to try and form it again. So that's how you get this exposed bone, which is the dry socket. And what can cause that? What can cause that blood clot to get dislodged? Smoking, drinking through straws, spitting. A lot of patients, what we see is they go home and they're bleeding a little mild blood, a little bit of oozing. This is normal. This is normal after an extraction, right? But you don't want to go home and just start drooling or spitting out, because that spitting will dislodge that blood clot right out from that extraction site, okay, after the wisdom tooth is removed. So don't do that. Definitely don't spit. Don't do any strenuous exercise. No running marathons with, a couple days after surgery. No bending down and picking anything up. No heavy lifting. Just try to take it easy for a couple days and follow those post-operative instructions. All right. Lee said TMJ relief, Botox. Now, Botox would help if it's myofascial pain. If it's related, you're stressed, you got bruxism, you got knots in your masseter muscles. Botox can potentially be an option, right? But it's also different for everyone. Vane said getting 3 teeth pulled. Any recommendations on recovery? I'm scared. Yeah, you could try icing for 24 to 48 hours, right? Swelling is going to be at a maximum 2 to 3 days after that those teeth are removed. Follow those post-operative instructions. No spitting the blood out, no heavy lifting, no smoking, no drinking through straws, everything I was mentioning about that before. Follow the instructions, okay? Rai B said, can you give example of your day was like, time studied, etc. during dental school to become an OMFS? Sure. So this is an example of what a day was like while I was studying for the CBSE in dental school, right? So I would get up a little bit earlier, say 5:36. I would do a block of UWorld before I go in during, this is the 3rd year of dental school, right? At dental school, we would have 2 hours of class from about 8 to 10. So I already did a UWorld block of 40 questions, breakfast, went into dental school. 8 to 10, kind of paying attention to the class, kind of not, kind of reviewing those questions that I got incorrect in that morning block. Then we have clinic from 10 until 1. So that's treating patients. 1 to 2 was a lunch break, back to studying, reviewing those questions I got wrong for the morning block. 2 to 5 was clinic again, so treating patients. 5 o'clock, I would rush or get out early. I would rush right to Panera Bread because we didn't have a real legitimate library. Panera was where I would study. I would bring my dinner. I would heat up they had a microwave in the little lounge area at Panera Bread. So I would heat my dinner up there. I wouldn't even buy it. And that was my study spot. I would leave my phone in the car. I would study from whenever I got there all the way until 10 o'clock at night. That's when Panera would close. And that was when I was just grinding. I would only exercise 1 day a week, so on Sundays. Yeah, that was the month and a half ish. That was the month before the last time I took it and I got the score that I needed on that CBSE. So that was when I was all in on that CBSE on top of dental school. So there you go, Rai. That's an example of that. User 3957. Why do dentists yell out random letters to hygienists? What do they mean? They're going through your teeth and looking at, one is either probing depths. That's one exam. The second one is they might be looking at where there's any demineralization or maybe some cavities, and they're saying M or O or D or L. M is for mesial, D is for distal, O is for occlusal, L is for lingual, B is for buccal, P is for palatal, F is for facial. That's on the outside. So those are some of the things, how we describe surfaces of the teeth, right? Okay. Jasmine said, how do you feel about DDS to anesthesia provider pathway? To dental anesthesia? I mean, it sounds good. It's now a recognized specialty, so dental anesthesia seems good. I'm not aware of what the residency experience is like, but it will be in a hospital setting for the most part. Joseph AB233. It's been about 65 hours since I got my 4 wisdom teeth out, and I just started minor pain after eating macaroni. Well, be careful when you're eating that macaroni. 65 hours. Yeah, I guess you'd be at. Right now, you'd be at significant swelling. You're starting to get out of that window. Yeah, just take it easy. Just relax. You're doing okay. Minor pain, that's fine. That's going to be expected, unfortunately. Vane said, if you have perio, should we go to a specialist for that? Yeah, I think that's a good idea. User 44577. Do you think... I just lost that. Here we go. Do you think I should take a gap year, graduating this spring? 3.8 GPA, 24 total science, but I have low extracurriculars. I mean, see if you need to take a gap year. Apply to the schools that you want to apply to, and if you don't get in, you take a gap year. Right? How does that sound? I think that's the pathway you should go. Joseph AB said, you just said that. Akriti Tandon said, do you think I could go to dental school with a 3.2 GPA without a gap year, or should I take a gap year? I would apply, and if you don't get into the schools that you're looking to go to, then you take a gap year, do what you got to do, grades, DAT, whatever it may be, maybe master's degree, and then you reapply. Okay? Digi said, I'm pre-dental. I learned that GPs can do all on 4. Why would I bother specializing if I could just do that? Because God forbid you make a big mistake, right? And that turns into a lawsuit. You're going to lose that lawsuit, right? Because the first thing they're going to ask is, what's your training on all in 4s? What is the inferior velar nerve? What is it? They're going to question you beyond belief about every part of the anatomy of the head and neck region, honestly. They're going to be asking you what complications can occur, what did occur that day, how could you have prevented it? Are there other specialists trained in preventing those injuries? And the answer is always yes. Generally, always is yes. So that's why. If you really want to be worrying about lawsuits, or you just don't care about your patient's safety in one way or the other, because that's kind of what it comes down to. There are specialists trained in providing the safest operations for that. That's why. That's the answer. Okay. Rai B said, I think you said one time D1 was the most stressful times. Can you elaborate, please? For me, it was D3. D3 was one of the most stressful times. D1 was stressful because you're really starting to acclimate. Stony Brook was where I went. It was combined with the medical school, and those classes were tough. In addition to those tough medical school classes, we were taking dental school, like hand school classes during D1 year on top of those med school classes. We were being compared with those med students, and we were doing more work than them. It was just, it was a lot. User 3957. How do bone spurs occur after wisdom teeth? Well, you could get bone spicules if, say, for example, you've impacted wisdom teeth. They have to use a drill to remove some of the bone overlying around the side of the wisdom tooth. You might get a little point, right? If the dentist or surgeon doesn't remove or smoothen down those bone spicules. That could be one thing. I don't know I think that's what you're asking, right? Princess TJ, come kiss me. Karayo Shikaj said, I have stab lab tomorrow. Any advice? I'm a D2. Good luck. Tell them to give you that injection fast. If I was getting that big ass needle in my mouth, I wouldn't want you to just be hanging out there for a minute like they teach you in dental school. I give that injection fast. I wiggle the cheek, I bang on the mandible with the Minnesota or the Stelden, and I give that injection within like 5 to 10 seconds. I do not want to keep that needle in there. I ask the patients and they'll agree, no, don't keep that needle in my mouth, that big ass needle. No, I get it in and out. What are we messing around for? Some people say that, the increasing expansion and pressure in soft tissue spaces can cause pain. Look, people want that thing out of their mouth. Get it in, get it out. Done. So that's my recommendation for that. Rai B said, your hair looks nice. How do you style your hair? Any hair products you use? I just use like Axe or Old Spice hair product, where it's like this little, I don't know if it's mousse or cream or it's just, I don't know, hair product. Style it up a little bit, and then I'll use a hair blow dryer just to kind of blow it back a little bit, blow it off my face. But thanks, friend. Patrick said Messi or Ronaldo. Ooh. I think Messi's a little bit classier of a person. Ronaldo started to complain in recent years. I'm not a fan of complainers. I'm not a fan. LeBron, I thought, was awesome in the beginning. And then he became this little wimp. He started diving. He started doing all these, like, now he's a soccer player. What happened to the men? What happened to the toughness? God, everyone just wants to complain these days. And I'll complain plenty, but guess what? I follow complaints with solutions. If you're going to complain, make sure you follow it up with an actual idea that can be productive and used to anyone's advantage as a solution, right? Don't just be complaining into the air. Nobody likes that. Snooky M2123 Panera Bread is the best. Yeah. Patrick said tough times, man. Yeah, it can be tough sometimes. Kevin Monaco said, would you recommend Cocoa Floss? Yeah, it's decent. It's decent. I've tried it before. AJ00009, what is your opinion on studying at foreign dental schools? For example, in Australia. Yeah, I mean, I would also take into consideration, do you want to work as a dentist in Australia? Because that would be a good reason to do it. If you go to Australia and come back, you might have to do some more years in dental school. Joseph AB233 said, when do you think I can eat normally without stressing? I would give it a couple days. It depends on what you had done. It depends on like what was done. Did you have teeth removed? Did you have bone grafting? Did you have a sinus lift? What are you going to eat in 3 days? Because what you eat can also reflect on the timeline. Let's say, for example, you get jaw surgery. We had a patient last week had a BSSO. So after a BSSO, we're going to generally recommend full liquid diet for some time, and then you could progress into a soft food diet. But you don't want to be going out eating steak for a few weeks, right? If you break those plates after the BSSO in the back, you're in some trouble. You're gonna have some problems. Okay. MMHS Swimmer said, what's the best way to handle tuberosity fracture when delivering 1 or 16? Well, depends on how much of it fractured. Is the periosteum intact? Because the periosteum definitely supplies a lot of blood supply to that region. Periosteum's intact. Sometimes, now it depends. This is not 100%, but sometimes you could just leave that tuberosity there. If it's really fractured off, sometimes it's connected to the tooth, whether it's the wisdom tooth 1 or 16. Just take it all out and then suture it up. Make sure there's no OAC, oral antral communication. Okay, make sure that's not there. Orlando said hi. Hi, Orlando. AJ_0009. What is your opinion on studying it? Dick Hertz, follow the live creator. Thanks, Dick. User 44577. What do you think about pass-fail schools having better quality of life in dental school? Some of them don't. But I do think for the most part, pass-fail schools have a better quality of life. I really do. Students aren't necessarily comparing. If they're ranked, yeah, those students are going to compare themselves to each other. But generally, students are just focusing on passing and figuring out what specialty they want to when they're at pass-fail schools. Columbia, Harvard. Is UConn pass-fail? I forget. Stony Brook is not pass-fail, but it's unranked, which I love. I love the unranked. It's not pass-fail, which still reflected. And my class here didn't have the greatest culture. So Rena McDavid said, Old Spice for men, please stop. Yeah, it's hair product. I use the hair product. Yeah, it's really good, actually. And it's like kind of waterproof. So it's great for in the rain. Yeah, just my thoughts. Karo Shikaj said, this is going to be my first time giving injections, but luckily it's on a mannequin. Yeah, that's part of it. Bob said, do you own a practice? I'm on month 3 of ownership. I don't own a practice. I'm in residency. I signed a 2-year associateship. So I start that August 15th and I finish that in like 2027. So I am hoping to be on the pathway to partnership. Ray said, can alcohol prior to multiple extractions cause issues with clotting? Absolutely. Alcohol affects what, right? It affects the liver. The liver processes a lot of that alcohol and could cause a hit. In addition to that, that beating it could take on the liver could affect the clotting factors in the blood, right? And so basically it can cause a little bit more bleeding. It could cause a little bit more oozing. I've noticed several times in the ED, we get these patients, they come in with these massive lacerations, right? And they're out drinking, maybe they fell, maybe they got assaulted, and they have these big lacerations. And you'll notice, or I notice, when you're sewing them up, even just putting the needle inside the skin, the epithelium, you could find that just that little tiny needle hole, even if it's a 6-0, that could cause bleeding. So yeah, you've decreased clotting factors when you give your liver a beating after drinking. And I've seen it during my laceration repairs. Those patients bleed more, a lot more sometimes. Luke, incoming D1, said, I was dying when you mentioned the I got coffee with my former self trend on the podcast. Luke, you've seen that. Yeah, I mentioned that with Dr. Wahan, right? But you know exactly what I'm talking about. I think it's cute, it's adorable, but I think that it's like way out there for a content theme, and everyone's trying to hop on the trend because it's unique, it's different. It really is. It's so cutesy, but it's like, all right, you're going the weeds to just find like real content to create at this point. Joseph AB2 said, asked when I could eat for context. I got 4 wisdom teeth taken out, top 2 sewed. They sewed up. Okay, I guess they were really high up there. When could you eat? Like normal? Like what do you want? What are you looking to eat? Because you could eat after the numbness wears off, right? But if you're looking for what you can eat, I mean, I would give it a couple days before that. This is not medical advice, by the way. User 44577, what made you choose OMFS originally, and how did you stay hungry motivated? I didn't want to be making dentures and stuff. I want to be putting in implants that the dentist or prosthodontist puts the denture on. So I don't know. I didn't enjoy the general dentistry stuff as much as I liked oral surgery procedures, for a daily basis throughout my career for 30 something years, right? So that's where we are. I gotta get going, guys. Favorite luxator or elevator? I would say the spade. I really like the back action spade. I think that's my favorite thing. I could get out like almost any tooth with that thing. I have one around here somewhere. It's one of Bloody Tooth Guy's instruments. Yeah, that's a good one. I was just thinking about we had a patient in the hospital, and a significant other came up to me and gosh, and they've been together since the 70s, and that kind of relationship, and they're together. One's like nonverbal essentially, and the other one is the significant other is there every single day, and just it's incredible to see that type of caring and love in a relationship. And yeah, I think this is what I want to end the podcast on tonight. Thanks for joining tonight. TikTok Live number 53, guys. By the way, I'm going to be giving the top 5 longest listeners, a shout out in the caption of the podcast on YouTube and podcast. Yeah, and it's just I was talking to him the other day. It was Thursday or Friday, and he's like, I was commending them. They're been married for like 50 years, and I was just like, congratulations, that's incredible. And he was saying like, yeah, time just really goes by so fast, and you could see that he was expressing the gratitude to be with his partner, and it really is incredible. Sometimes you just think about how fast things have gone, and you look back, and so things are always green on the other side. Sometimes you look back and just wish that you were still in the situation of somewhere, something years ago, and it's and having your whole life ahead of you. And I'm very young. I'm 30. I turn 31 in 2 months, so I'm very young. But it's just incredible to see someone who's lived like a very long life and with someone else, because I feel like strong relationships are so rare these days. Which is crazy. Just with the technology, the expansion of technology, everyone's got everything they want at their fingertips, kind of thing. It's crazy. Relationships don't last. The divorce rates have gone through the roof, and I don't know. I've always strived to want like a strong, long-lasting relationship, and I think I've figured out and found those fundamental pieces that's going to create that type of long-lasting relationship. But yeah, he was saying that, enjoy every minute. You got to enjoy the process and every step of the way. And you could tell that there was not one bit of regret in his voice, it's an incredible thing to hear and to really appreciate that, and feel it in someone's voice, because, life could get complicated sometimes, and still taking some time to enjoy the little things, the little moments. It's so good. I'm going to finish on this one. I was watching anime today, Attack on Titans, and one of the quotes was by this guy Irwin to another warrior, essentially, and he was saying, I just put this on the podcast earlier. He was saying, basically, don't get caught up in the plague of regret because that's a mood, it's a feeling, it's a depressed feeling, it's a distraction at the end of the day from your next decision. And if you're distracted based on a decision that you regret making, or a thing in your life, and you regret it, and you're getting caught up in that regret, that might affect your next decision that you also regret as well. And it could be anything. If you're like, in the Army or Navy, or in this case, a warrior, that could be fatal. You could die from that. The other thing but it could also reflect on the next decision that could be, I think he was saying like it could be your last. But yeah. So try and catch yourself when you're getting caught up in regrets and thinking about something in hindsight. Remember, that's distracting you from your next thing. And more importantly, back to that significant other that said that thinking about regret or dwelling on regret is preventing you from focusing on living in that moment, in the moment that you're in right now, and really living, essentially really living. So think about that. Catch yourself when you're distracted from focusing on the moment, focusing on the next decision that you're going to have to make, focusing on the next day rather than dwelling on something that you didn't get to do today. I do that all the time. It's a mistake that I make. And get after it. and just focus on the next step. All right. It's 10:02 Sunday night. Gonna get going, signing off. Thanks for joining tonight, guys. This is TikTok Live number 53. You're my podcast family. Thank you. All right, friends. Love you guys. Have a good week.